Afternoon. Today I'm just going to give you some idea about GERD in children. This is an entity which we have to have a high suspicion to diagnose, to treat, and then only we can. If we will not suspect, we are not going to pick it up. We are not going to treat it. So GERD in children, usually we suspect when a child will come to us with symptoms ki, okay, I have burning pain in epigastrium, or there is vomiting, or whenever they get up early morning they feel nauseous, or sometimes there is a pain in the retrosternal, that means in the chest, and the child usually says that it's a burning pain. But this is what is a typical GERD. In kids, the child can present to us with atypical symptoms also, like excessively irritable infant who is really irritable when he is sleeping in the night, or gets up from sleep and vomits, or is having multiple breaks in his sleep, or the voice becomes hoarse, or sometimes an asthma which is not responding to the normal treatment for a long time. So these are all atypical manifestations. A child can have a abnormal posture because and while the child is crying, and that also we call it opisthotonus, and that can also be a manifestation of GERD. It can be diagnosed by basically it's a clinical diagnosis only, but we can give a trial of medicines, and if child respond to it, we feel the symptoms were because of the reflux only. But sometimes you need special tests for this, which includes an endoscopy, biopsies of the food pipe, as well as pH and impedance studies in patients with atypical symptoms, in whom most of the time the endoscopy will be normal. Treatment is very simple. You have to have a diet modification that is required. Any obese child needs to lose weight, and medicines definitely have a role in which we give various protein pump inhibitors. There are many tablets, many suspensions which can be taken, and every child has a different requirement, which is totally age based and symptom based. The treatment has to continue for minimum 2 weeks, can extend even up to 6 weeks, 10 weeks, or even up to 12 weeks. Depending on the response, we have to taper the treatment. So again, I would say you have to suspect, and then only we can treat the symptoms. If we will not even suspect about reflux, it will be missed and the symptoms can be